Welcome to Thinking Green. I'm Rana, and this show will be taped. Actually, we're taping it on Friday, the 17th, and it will be shown on Tuesday evening in our regular time slot. So I'm sorry you won't be able to call in, but we will try to provide some contact information so that if you watch the show and you want more information, you can find out about it. My guest tonight is Dr. Catherine Hermes. She's a professor of history at Central Connecticut State University, and she's actually been on the show a few times talking about a variety of topics. But tonight she is a co-author of the book Explaining Suicide, Patterns, Motivations, and What Notes Reveal. So we are going to be talking about the book and about the findings and how the findings might be useful to us as we move forward. So welcome, Kathy.
Thank you. Thank you for having me on the show.
I guess the first thing I want to ask you, I think many of us, if not most, have been touched by suicide, but most of us are not trying to delve into it. We're trying to sort of look away from it.
Right.
So in writing the book, you and your colleagues, what motivated you to really look more deeply into the subject?
I think we had different motivations. So my friend Cheryl Meyer is a professor of psychology in the School of Professional Psychology at Wright State University. And she was the one who really started this project with her colleague Betty Young. They wrote a grant. They received 1,280 or more, actually, records from the coroner in Montgomery County and surrounding counties in Ohio. And they wanted to analyze them. And so their graduate students were brought on board to do some analyses. And what happened is that, unfortunately, Dr. Young passed away. She had a heart attack and died very suddenly. And so my friend had to continue this book on her own and with one of the graduate students, Tarnesh Irani, who received her doctorate a short time later. They continued writing the book and doing the analysis. So this was for them a pretty academic project. For me, it was a little bit different. I had lost a friend to suicide. So as Cheryl Meyer and Tarnesh Irani were working on the book, I was keeping track of what was going on and talking to Cheryl, sort of finding out about the research, but I was not part of the research team at that point until after Dr. Young died. And then as we were talking about this, I realized I did have some input and I was interested in working on it, and Dr. Meyer asked me to join the team. And so for me, it combined an academic interest, but with something deeply personal. My friend Marlene had committed suicide back in 2005. I had been grappling with this as a workplace bullying advocate. She was bullied in the workplace, and I was her executor. So it was very, very personal. But I had ascribed her situation to workplace bullying, and so I had explained it to myself. Now that I've done this research, I think I see things in a more complex way.
So in a way, I'm guessing it was almost a cathartic experience to go through this.
It was. It was very painful to read the notes because we had, out of those 1,280 cases, we had 174 suicide notes to go through. And of course, even with the coroner's reports, the deaths are very sad, very painful.
Now, I guess you mentioned the notes. And that there were over 1,200 cases studied. What was the general methodology of the research?
Okay. So the psychology part of it, they had a team that went over each of the notes and categorized the notes according to motivations and other characteristics. So they also looked at things like gender, race. They couldn't code for religion, and they couldn't code for some other things like even veteran status or sexual orientation, partly because the coroner's reports don't have any standard reporting requirements.
So you might really not know whether that information was complete or not.
Right. So we probably are underreporting in terms of veterans, underreporting in terms of LGBT, things like that. So it was all coded for that. They looked for, in the notes, they looked for an actual statement by the person about why, right? So if the person had experienced, for example, a lot of financial difficulties, but they didn't cite any of that in their reason, and no family member mentioned any of that, then it wasn't considered a reason. So it were things that appeared in the notes or things that appeared in the coroner's report that they came to know from a very close family member or from some other evidence at the case. And our coding sheet is actually in the back of the book. And I don't want you to zoom in on it or anything, but in the back pages of the book, you can follow along with the coding. It's too detailed to see on screen, but you can see exactly what they did.
Now, was there a difference between the cases you looked at when people left notes and when they didn't leave notes? Is there a difference between those groups?
We don't think there are major differences. Most studies involving note writers and non-note writers say there's not a huge difference in the groups. So we had 1,280 cases total. We had 174 notes, but some people wrote 2 or sometimes even 3 notes. So occasionally it's not 174 different people.
So perhaps 10% wrote notes.
14% wrote notes. And that's about the national average for writing notes. It's sometimes higher in other countries. I think in Japan it's a little bit higher, but that's about the average.
So I guess in terms of, one of the things you mentioned you looked for in the notes is reasons why.
Right.
So what kind of reasons did you find?
Right. So we came up with a few different reasons. Mainly, you can separate 2 major categories: interpersonal relationships and escape from pain. But within those categories, there are divisions. So in interpersonal categories, there were either people who were in abusive relationships, and so they killed themselves as a result of this combination of abuse and interpersonal relationship pain. And then there was another category in the interpersonal relationships where it was more like lost love or unrequited love or a broken relationship. So it wasn't necessarily abusive, but there was a lot of pain involved in the interpersonal relationship.
Now, I noticed reading the book that you mentioned abusive relationships. It isn't necessarily it's sometimes the abuser that's
It's usually the abuser who kills himself.
And not the victim.
And not the victim, right. And it's the same way in like the escape categories. So we have escaping pain, escaping multiple problems, escaping legal situations, financial situations. First of all, almost all of the people who kill themselves are men. They're almost all white. Their age range will vary, and minority populations or women might show up more in certain categories, but predominantly across all categories, it's white men who kill themselves.
I know, well, towards the end of the book, you talk about resilience. Is there a reason why white men seem like they might be a little lower on being resilient than other groups in the country?
So there are different theories to explain this. I think it's a difficult thing to answer. In some ways, people who constantly go through problems, so they don't have certain privileges and they don't have certain expectations about how society will treat them, might develop resilient characteristics. And it might be that white men don't have to have those characteristics to the same degree. that a black man or a black woman might, or a Hispanic woman, or even a white woman to some degree, that they don't have to steel themselves or prepare in the same way.
So there's maybe a missing skill set. And I'm sure, when you wrote this book, you really had no idea what our current political situation would be.
No.
But it does seem as though it has some added relevance now that we're seeing kind of almost the revenge of the white male in this country, and seeing a different dimension of, I don't know, some of the pathology of it, maybe.
I think that's true. And I was thinking about the same thing. In fact, I'm going to teach a course in the summer at CCSU. I'm not trying to advertise the course here, but on gender politics and suicide, because I don't know what the answer is. I don't know if people who kill themselves are more often conservative or liberal or somewhere in between. I have no idea, but I thought it would be interesting to take the same data set and kind of research it using historical methods and political science methods to see if there's some kind of correlation. So that's to be done.
Well, but that's an interesting dimension of it.
Right. And one thing is, there is a rise in the United States of white suicide, right? But there is also, for the first time, a decline in the life expectancy of white people. And 2 studies came out right at the same time. Just as we were finishing the book on suicide, a study came out that showed suicides were rising in every category, except for adult black men. And then coterminous with that was the suicide that showed, or the study that showed that white people were losing ground in the longevity area. And to some extent, that's because of the opioid problem, which is, of course, one element to the whole discussion of suicide, right? All of the people in our study committed suicide through shooting themselves, asphyxiation, hanging, taking pills. They died in an effort to die.
Right.
But many people do kind of kill themselves slowly, and that's not in our study. But I think there is a kind of perhaps malaise and suicidal mentality that we maybe haven't measured by looking at discrete suicides.
I think that might be the case. It seems as though a lot of what we've thought of as being kind of a safety net, at least for the last 50 years, is disappearing. And a lot of people do feel like there really aren't a lot of options.
And we noticed, for example, in the group of people who committed suicide as a result of financial disasters, right? That half of that group committed suicide in 2008, 2009, when the economy crashed. So half of that whole group, that's when they did it.
And, it's really sad. I know that people lose their houses because they have bills for medical emergencies. There are so many things that almost seem preventable if we would just figure out a way to create a safety net that you think citizens would all want.
Yeah, I mean, so much of what we examined in the last 2 chapters of the book was, how do you create communities that emphasize living, right? And that are not communities of death. They're not communities where people are stressed out. And a lot of it has to do with, first of all, providing social support. Everybody in our study who committed suicide did so because there was a lack of social support. And the second reason was they had no reason to live. So when, I'm serious about this, towns and cities, communities need to think very carefully about are we providing social support within our community in myriad ways? And are we helping people with a reason to live? If you live in a community that is down and out, there's no social support, perhaps there's a lot of unemployment, things like that, and there are no resources, you might lose people who have no reason to live and don't have anybody to help them figure out why.
So let's go and talk a little bit in detail about the reasons that you found. And there were some things that seemed like they were motivations and some other cofactors that weren't exactly
Right.
Motivations. So maybe we can talk about what's different things can go wrong.
Okay, sure. I'm going to show a graph here that, does that come up on the screen?
It will.
Okay, so what you're seeing right here is an XY axis. After looking at a lot of data about why people killed themselves, so all the things they said in their notes and that appeared in the coroner's report, I noticed that there were different levels of two things, intent and chaos. So I created a line that shows intent running up and down. So high intent at the top, ambivalence at the bottom, and a line that shows chaos, stability on the left side, instability on the right. And in looking at these groups, I saw that, for example, people who were in a lot of physical pain, they had a high level of intent. They really wanted to die. They were perhaps cancer victims who had no options left. And then, but their lives were otherwise stable. These were normal people without other problems except for the fact that they couldn't endure their pain. But they really did want to die. Conversely, you had people whose lives were chaos. That's the interpersonal abusive group. And they really did. They really wanted to die. They went out in blazing, flaming glory. And so that was, so I came up with different categories here, and you can see from the graph that there are two psychological categories, one where the intent is higher than the other, and that largely had to do with lethality of method. So to put it in the vernacular, do you take pills or do you blow your brains out? And not to be crude about it, but people who really want to die, they most often use guns or they hang themselves. And perhaps the other way is sort of carbon monoxide poisoning.
And taking pills could actually be a different motivation.
It could. They might have a lot of psychological pain, but it's not, at the same time, they might feel if somebody would just relieve me of the psychological pain, then I could actually live. And so there's some element of hope left in those people, I think. And I don't know if you want to keep that on the screen.
No, I think
but,
we can.
But I can talk about the categories a little bit. The one thing I found was most often the unstable people, suicide happens really quickly. It might even seem to come out of the blue, right? And because the intent is so high and the chaos is so great, it's actually very hard to intervene in those cases. At the same time, on the people who have, say, physical pain, again, the intent level is very high. I'm not even sure that resources are well spent in trying to intervene in cases like that. They have a very clear reason for doing what they're doing.
Right.
Right? On the other hand, in the people who are in the other quadrants, who are in the lower quadrants towards ambivalence, there's a lot of reason to try to intervene there and a lot of things you might be able to do. And so I think what intervention efforts have to focus on is what's needed for what group, right? And how much, not just effort, because you want to put effort into saving anybody's life
Right.
if you can, but what kind of resources and how much money and where do you target them is going to depend a lot on what the motivations are. Because some people you probably can't save, and like the people in physical pain. Now, there's some things you could do. For example, elderly people, often in this group, they kill themselves on weekends. If you had access to health care on weekends, fewer elderly people would kill themselves, even if they're in pain. I think access to health care has a lot to do with it. But if you really think about it, that the people in that group are, as I say, highly motivated.
Right.
The people in the interpersonal abusive, they're highly motivated. They want to die. You need a totally different kind of intervention for them. And there are some examples, like in New Hampshire, they have a program where gun shop owners are trained to look for signs, to evaluate. So if somebody comes in a tear, right, and they want to buy a gun, the gun shop owner is trained to respond to that person and to try to intervene. And that seems very targeted and very smart to me. Because
it's actually reminiscent of a Simpsons episode, I hate to say it, but where Homer Simpson goes into a gun shop and he's told there's a waiting period, but I want to shoot someone up now.
Right. And I think, gun shop, the other thing about this is, if you're going to try to reach people who are like you need to be the ones to intervene. So if a man who is perhaps a very hegemonic man, a very manly man, goes into gets suicidal ideation, the person who's most likely to reach him is another guy who's kind of like that, who can talk to him, and talk about the things that they share. So I think it's important to have people in the community, and again, it's sort of the partners in health method, right? So you train bartenders. Maybe you even train just community members who gravitate to billiard halls and things like that to recognize signs where they can help somebody intervene.
Well, I had not thought about that, but in that case, gun shop owners would certainly be on that list of people who should be trained to intervene.
Right. And I mean, this isn't a pro-gun, anti-gun sort of stance. Nobody wants people to commit suicide. And it's not about your right to own a gun. It's, do you want to make it safer for people? And, because a lot of times too, especially in these interpersonally abusive relationships, there's a high level of doing it in public, and sometimes there are murder-suicides or the killing of other people. And if I could just go to the slide, the next slide that shows the interpersonal relationship category, we did what are called group composite images. And what we did was we took all the elements that appear in every suicide, so lethality, violence, psychic, depression, emotion, and we said how much of this makes up the pie in any particular category on average. And so what these show are levels of these elements. So you'll see in both the interpersonal and abusive, in both of these, the abusive and the unrequited love, a number of them are done in public. A number are they have a high level of violence. They also have a high level of lethality. But the psychic in one is extremely low. So the unrequited love, very little psychic, that's a feeling of anguish and just terrible emotional pain, which you might think
Yeah,
You might
that's
think,
not what you assume.
right, you would think, but what's bigger in that group is the depression, right? So psychic and depression are the psychological aspects that make this up. And in the unrequited love group, it's depression. And depression tends to suppress your spontaneity. So those folks are actually a little more stable than the group that is more volatile. And that's the abusive people, and they have a lot of psychache. They're in anguish. Their emotions, the only emotion they admit to is anger. So that's why it looks like they have very few emotions, because they often don't discuss their anger. They don't talk about sadness or hopelessness. Their level of depression is not as high. So it's kind of an interesting combination. And the difference really is volatility and spontaneity versus planning.
So in terms of interacting with people of this, who would fit into this category, where do we put resources?
Well, you put resources in both, but you do them differently. So the person who is going to spend more time contemplating it, you have a chance to reach them through counselors, through medical intervention. Some of these folks, they do get treatment for depression. The only way that we know that so many people are depressed is because they had a diagnosis of depression. So that meant they did see somebody at some point that gave them that diagnosis. So folks at that level need to be trained, perhaps, not just to recognize that somebody is depressed, but to recognize the suicide tendencies. And then I'm still kind of pushing this model of you have to involve other people. They have to have training for family members and friends to understand what's going on. And I think if every human being in America had some little crash course, almost like we would do driver's education, right? Little crash course in what to do if you think somebody's suicidal. That would be a big help. You could help people like this in the unrequited love or lost love category. You might not be able to help the abusive person in the same way.
But you could reach out to some. And it seems as though something that could be done, maybe not exactly like driver's ed, but at a high school level.
Right.
We do personal safety courses. We do
Right.
all kinds of education and training. So this doesn't seem like it would be out of line.
Right. And the thing is not that, so if I'm a high school student or even a high school teacher, right, I don't necessarily have to be the one who saves the person. That's not your role. You have to be the one who helps the person get the help. And I think sometimes a lot of people are afraid. I know with my friend, I'll just take my friend, right? I knew about these problems with her job. I knew she was extremely depressed and anxious and not sleeping. I had asked her if she was suicidal, and she told me no. And I asked her if she ever were suicidal, would she tell me? She said yes. That gave me a level of, I guess, maybe comfort, that I didn't have to worry so much. That was not true. She couldn't keep that promise. And I know that now. But as what I could have done, so she sent me an email that morning saying I needed to go to my post office box. Now, what I could have done there, but I didn't do because of the running tape in my head, right, which is, I'm not sure what's going on. I am worried, but I wouldn't want to call the police or do something like that, because that might be a total overreaction, right? That's not the way you should think, right? It is better to overreact in some instances
And in
than
this
to do nothing.
case, you were like miles and
I was
miles
thousands.
away, so
I
it
was in
wasn't as
Connecticut.
though,
She was in California. I wasn't there to see it.
right.
But there were people in California, and again, I'm not trying to lay blame here, or say somebody should have stopped her. But just I think if we'd had some training about how to recognize things over the long term, we might have been able to prevent it. Not could we have intervened that very morning?
Right.
Maybe yes, maybe not. But over the long term, could we have stopped it?
And yeah, everything leading up to that day,
Right.
Perhaps could have been.
Could have changed.
Yeah.
And you don't want to involve. I think so many people who've had someone commit suicide that they loved. In retrospect, what happens is a blame game. Don't do a blame game because it's not your fault. But at the same time, I think it is important for us all to recognize that there are things that can be done for almost every single victim of suicide. For the interpersonally abusive ones, now again, they're spontaneous, they're fast, right? The interventions have to come maybe at the gun store when they're buying the gun, right? Maybe with their buddies who are noticing escalating anxiety or agitation, maybe on the part of the victim who has to pay more attention to what the abuser is doing and get out of the situation, right? So sometimes what leads up to these situations is nobody's leaving the pot boiler scene, and things are really, really getting very dangerous, and somebody needs to leave.
Now, in the book, in addition to the interpersonal relationship and escape, you talk about like grief and failure. How does that fit in?
So we didn't have too many people who killed themselves because of bereavement. But again, often they're pretty stable people usually, except something's happened. They've lost a child, they've lost a spouse, and they don't have the social support. And again, it's that reason for living. So they need social support, reason for living, and they lose that, and they're at high risk. Sometimes there are people close to them who can intervene, either counselors, sometimes funeral directors might be the one to see this. But again, they need training in order to spot who might be at risk and what to say to them. So let's say you come in and I'm the funeral director and I see that you're really suffering. I may think, oh, that person could be in danger of suicide. But if I don't know what to do then, if I don't know the next step, I can't help you. So maybe what I do is I say, do you need some counseling? Here are some counseling services. I think you'd really benefit from this kind of thing. Or, you offer that hand, that helping hand.
And then if there was some further kind of intervention, you mentioned in the book the difference between like the normal stages of grief and grief that just takes hold and doesn't let go.
Right. And sort of figuring out when someone is too long in one of those stages. And I think, again, this is an educational thing. Back in high school, there was a class my high school offered on death and dying. And it seems like a really grim thing, but it's a part of life, and we should be able to face that and perhaps learn about those stages. And if we recognize that someone is in a stage like that, again, try to provide some social support.
And our society is not particularly good at that.
No, we're not.
We don't like talking about it in general, and suicide is still attached with quite a bit of stigma.
Absolutely. There are a lot of people who think, at least of the Christian denomination, might go to hell, or there are, at least consequences for committing suicide, consequences for your soul. I think that's a big stigma.
It is. Well, and in historic times, there have been times when attempting suicide was a capital offense, which makes no sense at all.
It makes sense. Okay, so here's the colonial historian, right? It makes sense in that what you're doing is self-murder. And if you assume that society has a stake in life, in preventing murder, then you also have a stake in seeing that people don't self-murder. And I think that's something that's almost gotten lost. Like, now we think of punishing murderers, but some of that old idea of society having a stake in peace, not just in preventing murder, but in keeping the peace, means more intervention by society.
And it seems as though in so many of these cases, the people involved had just felt very disconnected in one way or another from loved ones or a social circle in general.
Yeah, yep. I mean, I think, so we had a case in here. This was a case close to my heart. We call this guy Nick, and he was a college student, and I think as a college professor, I see people like Nick all the time. Except hopefully they don't commit suicide, right? But I see they feel alienated from the other students. They feel like they are failures. Nick kept saying he felt like a failure. And, feeling like a failure is different than failing at multiple things. So if you look at our group in which you have people who are trying to escape multiple problems, they've got multiple problems, but they don't necessarily feel like failures. The people who feel like failures, it's not because of mistakes they make, it's because they feel it internally. It's not external.
So it's like they have expectations that they're not meeting, but it's their own expectations.
It's their own expectations. And so Nick really he says, I felt like a failure my whole life. He was working on his economics homework, and as he's working on the homework, he starts to write basically a suicide journal. And so the economics homework kind of turns into his suicide, part of his suicide note. And I think he also went through the stages of grief in a way. So we think of that as the cancer patient goes through the stages of dying and grief about dying. He went through it. He starts out sort of saying, well, if I just knew that X would happen, right, then I wouldn't have to kill myself. And he starts kind of bargaining, right? And maybe if I had a sign that I shouldn't do it, and no sign comes. So he's going through anger, he's going through bargaining, he's going through grief. He worries about his mother. At the same time, he thinks his parents have always been disappointed in him. And then he kills himself. So he's ready to die. But he's worked his way through all these stages. And you can see it in the note.
Wow.
So it happened pretty quickly over a period of days. And it's very sad.
Now, for the people who left notes, what kind of different kinds of messages do they want to leave to the survivors?
Yeah. So a lot of people actually wanted to tell survivors that they love them, or that they felt love for other people, which is something you might expect. I don't know. Sometimes they expressed great anger and they blamed other people for their circumstances. Sometimes the notes were really cryptic. So a lot of notes, believe it or not, they're almost like Twitter length. They're 150 words, not characters. That's the average length of the note. And sometimes it might be, I leave everything to my kids, or I'm really sorry. Sometimes that's all they'll say, I'm really sorry. Yeah.
Now, are there any other factors that you found that people should like be on the lookout for?
So I'll tell you, the one thing that, as I was looking at these cases, it's so many white men. And so I thought, but it's not obviously all white men, right? Some
Right.
white men do very well in this world, and they're not going to kill themselves. So what makes these white men stand out? And the big thing that I noticed was an almost extreme idea about masculinity of a certain kind, very patriarchal or hegemonic, or sometimes even what they call hyper-masculinity. And I want to give a shout out to my colleague Jason Sikorsky in the psychology department at CCSU, who was the first person to introduce me to this theory. But hyper-masculine men are the big risk takers. They aren't necessarily all muscle-bound and, Sylvester Stallone kind of thing, but they're risk takers. They think men should be in control, not show emotion. They tend to be very stoic. But in hypermasculinity, they might also be violent. In hegemonic masculinity, they might share some of those categories, but they aren't, or characteristics, but they aren't as violent. So these are people who probably spend a lot of time outdoors, or taking risks in other ways. They might be gamblers. They might, there are different ways to take risk. And they have a hard time when things fall apart because they don't share their emotions. They think that they should be in control, and so if something is not in their control, it's more disastrous for them than for other people. And I'll give you an example here. This example is not in our study, but has been written about in the New York Times. There was a person in Ohio, lived very close to where we did our study. He lived in Columbus and he went to college there. He was on the football team, and he was raised by his father and his uncle to be a fighter from day one. I mean, as a little kid, he would be in fights, staged fights with his father and his uncle, learning how to box and wrestle, and he was a manly man. And in the fraternity that he lived in, his housemates were actually a little afraid of him because he was so violent, and he broke furniture in the house. And many of them said to the reporters that were doing the study that he was the most manly man they had ever seen. So they recognized it was masculinity. But anyway, he broke up with his girlfriend and went missing for a little while. And they found him, he had shot himself in a garbage dumpster. And it's really heartbreaking. I mean, this was a young man with a lot going for him, but he had such an extreme idea about masculinity. He couldn't talk to anybody. When his girlfriend broke out of his control, he was so angry he didn't know what to do. He went and got a gun. He could have shot her. He didn't, right? So maybe some other masculine virtue, like you don't hurt women, stopped him from doing that. I don't know. But he turned it on himself, and he felt like garbage. And that's clear from where he ended up. And we need to raise boys who have a healthy view of their masculinity, who are proud to be men, and maybe enjoy the outdoors, or like taking risks, but in a way that doesn't prevent them from sharing emotions, seeking help when they need it, feeling community support, and that kind of thing.
And it seems like a really tragic ends, because ultimately, in almost all cases, people are very alone when it's happening.
Right.
So, I don't know, I think we may have almost 10 minutes left.
Okay.
Oh, 6, I'm told. So let's talk a little bit about protective factors and maybe what resources are out there and what resources we should work to get out there.
Okay, so
all in 5 minutes.
All in 5 minutes. So Protective factors. I think protective factors are both external and internal. We talked a little bit about this, about resilience, right? So one of the things as parents people can do is raise kids to be resilient. When they fail, let them get back up, right? Teach them to cope with that, to cope with feelings of disappointment, depression, those kinds of things, in positive ways, right? Teach them to get over it. That's not a silly thing. At the same time, if you approach it as, well, just get over it, that's not good either, right? Get over it by sharing your feelings, talking it through, finding support to help you get over it. Because again, social support is hugely important, right? Make them feel valued so they never lose a reason to live. If you feel valued as a human being, then if you lose your job or you lose your house or other things happen to you, you still have value.
Right, and still have a reason for living.
And still have a reason for living. I mean, this is easier said than done. Okay, on the flip side, resources. So we found that, other studies basically have shown that many people who are suicidal will report to an emergency room for suicidal ideation. And a huge number of those people actually will commit suicide. So emergency departments have to be a lot more attuned. One study showed that even when presenting for suicidal ideation, patients were not asked if they had a gun in the home or other lethal drugs or things they might use to commit suicide, right? And that seems like a pretty basic question.
It does.
Like, how were you thinking of killing yourself, and do you have that at home? So that is one way to intervene. Another is, I think, to perhaps have kind of use new technology, right? So there have been in development some apps that you could have on your phone. If you're feeling suicidal, you can hit the app, which will then connect you to your support system, right? Maybe a pastor or a rabbi or an imam or your teacher, but also a friend, maybe the parent, whoever you trust, and it would connect you there. And of course, there are risks with that too, right? People can abuse that system, but it's better to have it, I think, and see what the results of that are than to not develop these tools.
And of course, in general, I think in the United States in particular, we need to, feel like it's okay to use taxpayer money for safety net services of all sorts.
Well, because in the end, you will save, right? Suicide is highly expensive for society. And I mean not just in terms of like funeral costs and things like that, but the effect it has on family members who then often need mental health counseling, the effect on perhaps other people, friends of the suicide victim. There is such a thing as cluster suicides, point clusters, where one person in a group commits suicide and it's likely to happen to another in that group. So there are dangers that spread because of suicide. And then just the toll it takes on the community. Your resources would be better spent trying to help people live than cleaning up after they die.
We would hope so. Is there anything, since we probably only have about 1 minute left, any place that people can go to get more information about this?
Yeah, I mean, so we posted some numbers. There are suicide hotlines everywhere, and they're on Facebook, they're circulated, they're on Google, but of course, if you're suicidal, you may not stop to look that up. There are, so in addition to hotlines, there are chat rooms, places you can, talk to people. If you're at college, you can go to your wellness center. But of course, it all depends on people communicating with someone else.
Well, thank you, Kathy. The book is called Explaining Suicide Patterns, Motivations, and What Notes Reveal. And it is dense going, but really interesting.
Well, thank you.
So thanks for coming down to New London.
Thanks for having me. This went very fast.
Yeah, it always does. So this will be aired on the 21st, and then on the 28th, there's a new secular coalition in Connecticut, and we have a few representatives who are going to be talking about that at the end of the month. So we'll see you then.
Okay, thanks.